Please state your name and date of birth.
Mayor B. Davidson, April the 11th, 1935. When I first arrived in 1969, it was as a junior faculty member at UCLA. In those days, we did not have requirements to be on call in the evening or weekends. And so I wanted to use some of that free time in order to try to get medical care to people who didn't have it. In those days, very few older people had it. Matter of fact, older people were the leading group in the poverty area in the country. And so I asked a colleague of mine at UCLA, and he's directed me toward Venice. He said, there's a big issue with Venice. They don't have enough medical care there. When I directed my attention to Venice and looked into it, I found that it was a community of about 50,000 people at that time. It was evenly split among three groups. First, there were African Americans, and second, there were Latinos, and third, there was a white group. The white group was composed of two components, one of which were older retired people, and the other was, in those days, the term was hippies, often in those in the art world. And they had a problem with medical care coverage because although there were 6 doctors there, only one of them would ever see patients that had Medi-Cal, and he would only see them one afternoon a week. If you were sick at any other time, you had to go to UCLA to the emergency room. And the people in Venice, I've also found out that there was a group that had been trying for 3 years to get medical care there, not very successfully. It was headed by their chair of the Venice Health Council, as it was called, believed that the way to get good health was to have organic foods. And that was their main thrust at the time. But the people at Venice said that the clinics at UCLA treated them like guinea pigs, and they didn't like to go there, but they had to if they were sick at any other time and if they didn't have Medi-Cal. And a lot of people had no medical care coverage at that time. And so there was a tremendous need to get medical coverage for the people in Venice. The Venice Health Council was composed of 3 groups of people, 7 businessmen and professionals, 7 artists, and 7 community members. And so that was a good cross-section of Venice at the time. The county opened a clinic that they said was to take care of people in Venice. Unfortunately, the clinic was at 26th and Pico, which is several miles away. And I'm not sure how the Health Council got this impression, but I was told that they were under the impression that the clinic was going to open in Venice, be available 24 hours a day. And so when the clinic actually opened, and that was in November of 1969, they actually went up and protested. Now, Dr. Rossman was a chair of the Public Health Committee of the Los Angeles County Medical Association, and as such, he went to the opening of this clinic at 26 and Pico. And he saw these people protesting, and he went up to them and asked what was going on, and they explained to him, and he diffused the situation. He said, listen, stop your protests, and I'll work with you as in the LA County Medical Association. I'll work with you, and we'll try to get you health care here. And they did. And so in November 1969, he joined the Venice Health Council, and they tried to get medical care there. And when I got involved in 1970, at the June of 1970 is when my first experience with the Venice Health Council. They unfortunately were not able to get it at the time. And so he and I and another person, his name was Jim Freed, he ran a dental clinic in Venice. And so let me explain his role in this. The state had a small grant to open a dental clinic in Venice. It was Rose Avenue and Lincoln Boulevard that would be open at night. And they would be able to train their dental students there with faculty supervision. And that's how he was involved on the Venice Health Council. And so when I got involved with Dr. Rossman, well, there's obviously, you needed 3 things in order to have a clinic. You had to have a site, and you had to have volunteers to take care of the patients, and it turns out you also had to have malpractice coverage. So I went to a party. I had never met Dr. Freed, but I just went up to him, a party run by UCLA's public health department, and asked him if he would be okay if we tried to put a medical clinic in his dental clinic in the evening. The dental clinic on Lincoln and Rose was open during the day for the dental students and the faculty to treat patients. I asked him if it would be okay if we used his clinic in the evening, if we could see medical patients there. And he, as a member of the Venice Health Council, was very agreeable to that. So we had the site. Dr. Rossman asked his fellow private practitioners, and they said they would volunteer at such a clinic. And I checked with the internal medicine residents and interns, and a number of them said they would volunteer at night also to see clinics, to see patients. So we had the two basic ingredients, and then we had to work on getting the third, which was the malpractice insurance. Fortunately, the Lyndon Johnson's program was for health care, still had some money left in it before it stopped at the end of 1969. And so we were able to get some malpractice coverage from them. And so we had all the ingredients to open a clinic, which was the site, the volunteers, and the malpractice coverage. And the clinic opened October 12th, 1970, and we started to see patients. When the clinic first opened, there were long, long lines around the block. We could only see about half of the patients because of the limited time and volunteers we had. So as I said, the Venice Health Council had their own issues and their own ideas about a medical clinic. But among all of us, we were able to work out on a purely volunteer basis how to get this clinic up and running. One of the people working at the clinic was a physician's assistant. Her name was Kendra Gorlitsky, a marvelous individual. And her husband was a physician in the West Side. And they went on a tour, a cruise. And on the cruise, they met an older couple, Irma and Lou Colin. And the story goes that Irma and Lou were bored with hanging around with these older people that were just talking whatever older people talked about at the time. And so they sought out younger people, the Gorlitskys. And Kendra put a plea out for Irma. Irma, by the way, was a political fundraiser. And so Kendra asked her if she would turn her attention to try to help the clinic get some funding. And then Irma, bless her heart, had the idea that there are artists in Venice, so we ought to do an art walk and have the artists have their pieces that they would show the public and charge for that. And we would also have a tour so the public could go to all of their art galleries, and that would draw a lot of people in. And she and her friends in the Beverly Hills, mostly frankly the Jewish community, put on the art walk. I think in 1978 was the first one, and we raised $50,000, $50,000, and that really set the clinic on its course and expanded year after year. There would be more artists, and the artists were very much involved in setting it up. Let's see if I remember some of their names. Frank Gehry was one of them. Laddie Dill John was one of them. A group of them started and got their artist friends together and helped get it going along with Irma and her friends. So it was a marvelous working together of those two communities. The other thing that helped us at that time was UCLA. It turned out that I wanted UCLA to be involved because there was a big need there. They needed a place to train people, to train residents and staff, and train the people in the outpatient setting. And UCLA, we had some people who were provosts and in the administration were very keen on helping us. And they were able in about 1978 or 9 to get the Venice Family Clinic to sign a contract with the regents of UCLA. We became a department at UCLA, and that gave us the malpractice coverage. It also gave us a little bit of extra money from UCLA. And so that was also a very important thing to keep us going. We opened a dental clinic. We opened what we call an integrative medicine clinic, acupuncture, chiropractor, behavioral health. And all through these years, we've been able to get, fortunately, more and more support, and we're able to see more and more patients. We have about 80 or 90 full-time staff that are providers, and we have a volunteer group that is up to 500 people, about 300 physicians, and a large number of other volunteers. We actually provide food services for food insecure people. We have a Head Start program that takes care of a tremendous number of families. And so this has become a tremendously successful, based on so many people and the hard work of all our CEOs. What can I say? I'm so proud of what we've been able to accomplish. Well, I think the easiest thing to say is it's probably the most important thing I've done. I've been in academics and done research and taught and seen patients, but in terms of the whole spectrum, this has obviously made a bigger contribution than anything else I could have done.